Well, it's a virus, first of all, but like many, it takes various forms and causes different types of symptoms. Norovirus is primarily one that affects the gastrointestinal tract, your UGI tract. So symptoms can be like you find with other viruses, like fever or sometimes aches and pains, but primarily it's nausea, vomiting, diarrhea, and so forth. And so those are the primary symptoms. Um, it's a pretty common virus. I think it causes, over 2,000 outbreaks every year in the United States alone. The CDC tracks them. And so it's not unusual to see certain outbreaks, but sometimes they occur more frequently in certain settings and also in different times of the year.
Okay. And so, with norovirus, what can people do to prevent catching it?
Well, it is contagious, but the good thing is primarily a proper hand washing and hand hygiene is really the most important defense. And it's important in norovirus to note that using soap and water is really the best way because the alcohol-based hand sanitizers that we often use frequently doesn't work very well against norovirus. And so you might find yourself in a scenario where that's the only thing you're using. That in of itself probably isn't going to protect you against norovirus. So truly hand washing with soap and water is critical. And if you're ill or somebody else is ill, those individuals should not be handling food, which could be another way of spreading norovirus, or certainly caring for others, who might be able to get infected from that transmission.
Okay, and should people go to the doctor if they have norovirus, or is this something they can take care of at home?
Almost always it's self-limiting, which means you can handle it at home with usually hydration, sort of drinking fluids, resting, and washing your hands and avoid spreading it. In some cases, if people are severely immunocompromised, very young infants, and people who might be very old, could require additional supportive care, which means they might need IV fluids. But there's no specific antiviral medication that's used to treat it. So almost always supportive care, rest at home will manage it. But in those severe instances, people might need to seek medical attention.
Okay, and is there anything else that you think people should know when they hear about norovirus? Because I feel like a lot of people are, getting very antsy and kind of freaking out.
Yeah, I mean, there's some things to remember about it. One is that people often associate it with cruise ships, which is true. Of the infections and outbreaks that happen on cruise ships, norovirus is almost always the culprit, or not 100% of the time, but very frequently. That said, I think less than 1 to 2% per year of the cases or outbreaks that occur actually happen on a cruise ship. So the volume isn't as high. A lot of the infections we see are associated with sometimes food outbreaks, and so the CDC will often, let us know if there's been an associated with fruit, certain types of food, like they've had it in leafy green vegetables like lettuce, sometimes in fruit, sometimes in shellfish, and so it's important to be aware of those notifications. And again, any area where you're going to find yourself in close quarters or shared spaces with, shared touching of surfaces, it's always possible to spread it. But the good news is, for the most part, it's relatively minor in terms of most individuals who are relatively healthy. So really always being diligent around hand hygiene is probably the most important thing to remember.